South Sudan hosts over 500,000 refugees in camps across 5 states. The largest number of refugees are from Sudan, who live in camps in the Upper Nile and Unity states. Fueled by ongoing conflict in Sudan, this figure has almost doubled in less than 18 months, underscoring the growing impact of the crisis across the region.
والله في بلدنا هنا زمن جينا متحركين من البلد الشيء خلانا جينا به هنا المشاكل بس بتاع الحكومة اللي حصل ده زمن المشاكل ده قام لنا كده ده في بلدنا ما السلاحات الأصليات الكبار ده ما ريحونا فوقوا بيجدئونا بالأصليات الكبار ده زمن جينا متحركين عشان نجوا هنا في الشارع بقينا تعبانين والأكل بقى صعب علينا والشراب بقى صعب علينا والدواء ذاته بتاع العيال اللي بقى جبال العيال ده بقى صعب والعيال في الشارع أمراض ما رياهم يوشي اللي خلانا جينا بو هنا.
The biggest threat to people's lives in the refugee camps is malaria. There is also the risk of arboviral diseases spread by different mosquito species, which include dengue, Zika, and chikungunya. Poor sanitation causes flies to spread diarrheal disease, which is the third leading cause of death in babies and young children.
In this setting, there are a lot of conditions that are favorable for the increase of malaria cases. Mainly, there is displaced population, both we have the returnees and also refugees. And frequently, we see also flooding from June, July, all the way to November. Every year there is rains, and the rains are heavy sometimes. And we have floodings, historically huge floodings that had human and animal cost as well. So these floods are very good breeding site for the increase of mosquito population, and thereby also increasing the number of malaria cases or even other vector-borne diseases in this setting.
However, all these diseases are preventable and people's lives can be saved when there are well-planned interventions. The Mentor Initiative has been delivering vector-borne disease control activities in Maban refugee camps since 2012 in collaboration with the government of South Sudan and refugee and host communities. These activities include indoor residual spraying and fly and larval control, which help reduce the population of disease-transmitting vectors.
The indoor residual spraying is a large-scale spraying that we do, spraying of the shelters where the communities live, and this has an effect on reduction of the mosquito population after biting and before biting.
الناس زي جو قريب ده يلا جو رشوا البيوت ده كل البيوت رشوهم لأنه بحمي البعوضة وبحمي الحشرات لأنه البيت بتاعه كان ما رشوه والبعوضة بكون كتير لكن الحمد لله الناس جو رشوا زمن الملاريا مساكنين دي شهرين بس لقوا فين الملاريا مشين مرتين بعد أخدتها فوق وادوني هبوب جبته يلا الشيل أنا خايف بيه وحسي في الملاريا ما قاعد بفكاني ده يلا بعدين تاني ما هو كان رجع لي والمستشفيات قفل تاني نعمل كيف ده الشيل كعب أنا خايف بيه.
The primary goal of the program is to reduce morbidity and mortality amongst refugees and returnees by killing the mosquitoes, flies, and other vectors that transmit malaria, diarrheal, and other diseases such as dengue.
What does it mean for us to kill the larva? It means we will not expect the adult mosquito again to increase in density within the community. Once we apply the chemical, it kills the larva in order for it not to move from larva to pupa and then goes out.
حقيقة المشروع بتاع مينتا مشروع مهم مشروع تختص في مجال صحة البيئة والإنسان. هذا المشروع بيقوم برش المبيدات الحشرية ذات الحصر المتبقي في داخل المنازل ومكافحة الملاريا وبعض الأمراض الناتج من الحشرات كالقلزار داء الفيل والحمى الصفراء والدنك.
The biggest impact that we know is the reduction of the cases. I will give an example of 2017. By then, Mentor Initiative was not able to do the indoor residual spray because of some funding crisis. So that year, we have seen a shoot up in malaria cases across the camps because the residual spray was not done. But the next year, when we did the residual spray on time, the cases has reduced.
Part of an integrated vector management approach is the use of new tools developed to be effective in challenging situations where other tools may not be viable. Spatial repellents are an innovative class of vector control tool that have been tested and implemented at scale to provide protection against most common vector-borne diseases. They are easy to install and protect people during the day and all night in any type of shelter.
If we don't have the interventions, definitely the prevalence will be more, the incidence, the new cases will increase, and definitely the mortality and morbidity of malaria will also increase on the other hand. So definitely without the intervention, there will be more burden that could be more overwhelming, and we hope that we will manage to maintain and sustain, and not only that, advocate for more resources to make sure that we can reach every person. We are not alone in the fight, but we do collaborate closely with our partners in the fight against malaria by expanding access to life-saving vector control interventions.